I'm Farisa Pilot, 52 years old. Approximately a year ago, I was diagnosed with liver cancer. I didn't have any desire to recall that terrible day in my life. I thought everything was over, but fortunately, there are doctors who supported me, encouraged me, and gave me the hope that the fight made sense. And I started fighting. From 8 segments of the liver, 5 were incised and 3 were left as a result of the surgery. 1 year has already passed since the surgery, and I feel myself great. I'm so happy. I would like to welcome you on behalf of West Regional Center of Modern Medical Technologies, where our team has performed a number of the most complicated surgeries in liver oncology. My aim is to give our story today not only advertising but also educational significance. In particular, now we deal with the non-operated case of liver cancer, which was brought to the possibility of operability by a multidisciplinary team with consistent and step-by-step management. Welcome on behalf of our clinic and the team, the purpose of which is to support a high-tech surgery in Georgia and specifically in our region to help all those oncology patients who due to different kind of reasons had to travel abroad for treatment. In our present case, it is result-oriented medicine, and I want to describe why, how, and for what reason and surgeons should take the appropriate risk to save a patient's life. A young woman was diagnosed with a voluminous liver cancer spreading to the left ventricle, a tumor invasion in the middle vein of the liver, and a tumor thrombosis of the posterior branch of the portal vein. The woman has strong signs of intoxication in the form of vomiting. In the first stage, a biopsy of the tumor was performed and the tumor of the intrahepatic bile ducts was diagnosed. Computed tomography shows no signs of secondary damage. Therefore, in this case, it's a surgical intervention, which unfortunately is not possible in this first stage. Due to the fact that the large area of the liver is damaged and its resection will develop post-operative liver failure, in the first stage we did not give any preference to systematic chemotherapy and local regional chemoembolization was planned, which involves the introduction of chemically loaded embolic agents into the tumor-feeding blood vessel, which after 2 days resulted discontinue of vomiting in this case. This intervention enabled us to plan the process, and in the second stage the embolization of the portal vein was considered, which involves the complete embolization of the portal vein branches in the liver, and in this case the 4th segment of the portal vein system, which allowed the tumor to stop. Healthy tissue began to increase in volume. A gold interval was selected during which the liver volume was assessed by computed tomography volumetric, and it was considered that this volume was sufficient considering the mass index to avoid postoperative liver failure, and therefore volume surgery was performed. Muscle mobilization was carried out as the most complicated surgery was performed for the first time in the region. During this time, 5 segments were removed from 8 segments of the liver. An enlarged right hemihepatectomy was performed. The duration of the operation lasted about 10 hours. The loss of neutral surgical blood was not more than 300 milliliter. I would like to mention one aspect in terms of surgical complexity, which is the embolization of placenta, which was treated with portal vein confluence during the portal vein embolization, and consequently the portal vein was intraoperatively opened and the main branch was removed. Morphologically, no signs of cancer metastasis were removed from the removed lymph nodes. The patient was discharged from the clinic on the 16th day in satisfactory condition. She has undergone a full course of postoperative chemotherapy and she is in satisfactory condition at this stage. I would like to point out the financial side of similar surgical interventions and say that in any European countries, the volume of such kind of operation is similar, volume exceeds 60,000 euros. While in our country, this financial cost is about 3 times less. Increasing medical capacity is a guarantee of health because in the conditions of strong health care, the population feels more protected, and I'm proud of the fact that our team and our clinic have been able to do what has not been done in the region so far. This is the merit of my favorite doctors, Professor Merab Janalitzi and my favorite doctor, Lekso Tsivragidze. I would like to thank everyone, including Mr. Dariel Kitiashvili, his support and staff. I'm very happy and I want to be proud that we have such a clinic in Kutaisi where they support patients in every way, help and encourage them. Nowadays, I can boldly say that cancer is not a judgment.